Good morning, everybody. It's great to see so many of you joining. I can see a few people coming in. We've got a number of people who've expressed an interest in coming today, so we're looking forward to welcoming you all. My name's Mike Marriott. I'm a clinical psychologist and principal lecturer at Nottingham Trent University. And also I am the co-chair of the group of trainers in clinical associates and applied psychology. So it's myself and two other colleagues who are going to be talking you through today this information to do with career development for CAPS, how they approach this post-qualification. We're going to be looking at some of the opportunities that are available to CAPS and thinking about the right ways of approaching that. This session will be recorded and available to view after the event. I will be sending an email out within a month to help people access that recording. There isn't any chat function available in this event, but what I'm hoping that you should all see is that in the chat there is a VVox space, which is a question and answer board. If you've got questions about the things that we're presenting along the way, feel free to use that Q&A, and we will, as I say, we will look to we'll see if we've got time today, we might respond to a few questions. Inevitably, there'll be more questions that we're able to come to today, so we'll take time to consider the themes that are coming up and send responses out by email. So that's only possible if we've got your email. If you haven't pre-registered for this event, that's not a problem. There is a form also in the chat for you there that should enable you to register and make sure that we've got your email. So the way this first session is going to run is that the three of us are going to talk on a little bit of a different focus. First of all, going to be inviting Angela to join us, and she's going to be talking about the different career pathways that we think CAPS are able to think about, introducing you to a career planning tool that she's developed along with colleagues at UCL. I'll then have a bit of time talking to you about what we're terming the landscape of the workplace. And then Layla is going to join us to talk about the ways in which you can apply the ideas that Angela and I have introduced to you, and how you could apply that into your career in terms of planning your CPD. Once we're done with that, if there's time, we will have a look at any questions that have come in and answer any key ones that are possible. If not, we'll send out the email. There are, as many of you will know, there are workshops happening after this event. So we're being joined by over 100 people online. There's also a separate process that's happening in the Southwest. It's been organised by the Southwest CAP Community of Practice. So kind of like a wave to those of you who I know will be sat in the lecture theatre at Bath at this point right now, but also for those of you in the Southwest who will be joining the hybrid event. I know that you've got a workshop to join. So workshops will follow. We'll be finishing this event at 5 to 11 to make sure everyone has a little bit of a comfort break before getting into the next elements. Okay, so without any further ado, I'm going to hand over now to Angela and move the slide on.
Great, thanks Mike. Thanks for the intro. And great that so many people can join today. So as Mike's mentioned, my name's Angela Husband. I'm just taken up role as Programme Director of the Essex course, and I've worked for some time as a lecturer for the UCL course as well. I've also, in my previous roles, worked alongside CAPS in the workplace, developing their roles. And I guess that's what's got me really interested in developing career pathways for CAPS. So I'm going to talk to you a little bit today about career pathways to CAPS with reference to an infographic tool that we developed as part of the work I was involved in exploring career progression for CAPS at UCL. So I think Mike's going to put the link for this in the chat, and you can find the infographic on the UCL website. And I encourage you to look over that in your own time. I'm going to talk to you about it a little bit today and how it's developed. So essentially, we identified four main pathways: clinical and service development pathway, education and research, therapy, and applied psychology. The graphic is fully interactive, so you can click on links to take you to the pathway summaries and further information. A common route for CAPS at UCL has been the applied psychology pathway onto clinical psychology and counselling psychology training. And as I'm sure you're aware, this route is well established, so I won't be talking about that much today. So today I want to focus more on some of the less familiar and developing routes of clinical leadership and service development and therapies as well. So I'm going to talk through those in a bit more detail. So maybe if we move on to the next slide. So as you can see from the clinical leadership and service development pathway, potentially the lofty heights of chief executive officer could be the limit, but we focus more on the lower rungs of the ladders. So firstly, for this we researched current job descriptions and person specifications available for jobs advertised to explore the overlap with the core skills and knowledge of qualified CAPS. By clicking on some of the lower banded entry roles, you can see these examples and suggestions for how to overcome the experience barrier through additional training, CPD, or targeted workplace opportunities. A key thing for clinical roles is registration on the BPS Wider Workforce Register, which Mike will talk through more in a bit. Layla is also going to talk about CPD opportunities. However, just from our review, there are a few quick tips for progression in this pathway. So firstly, for the clinical route, there was an expectation to supervise or line manage staff.
Hi, so Karen, the VVox links appeared in the chat.
Mike, we've got your audio on. So a key thing on the, is for clinical roles, it involves registration of BPS Wider Workforce Register, which Mike will talk through. But firstly, for the clinical route, there's an expectation to supervise or line manage staff. So if you're interested in this route, you might want to consider taking up opportunities to supervise junior staff and build on your knowledge and experience of supervising others, including aspects of line management. There was also an expectation of increased knowledge and experience in risk management for some roles, and that's particularly important if you're hoping to move on to team leadership positions. For the more service development based roles, a good level of project management experience is needed, which you have service related research experience to highlight here, but this could also be acquired by project management or QI opportunities within your current roles. For both types of role, taking up opportunities to support management or team leads with operational leadership or projects could put you in advantage, alongside utilising trust management and leadership training. We also want to acknowledge that a major barrier can sit with the employer's knowledge of the CAP role and competencies. In some cases, opportunities to raise awareness about the CAP role, either directly with employers, where you've had those links, or by targeting roles that are advertised within services where the CAP role is already established, might be a way of breaking down this barrier. Next slide, please. Okay, so to move on to the therapy pathway, similarly with the clinical leadership pathway, there's a helpful summary document. While if you're interested in particular therapy modalities, you can click on these directly for more info. In general, there's a recognition that in most cases, to progress to Band 7 psychotherapist roles, further training to enable registration with an appropriate professional body, for example, BCP or BACP, is necessary. This would open up opportunities for further training in other modalities, for example, EMDR, as well as potentially for more senior roles, subject to further training and experience. You may find it helpful to link with therapies training leads for help and advice if you have these roles within your trust. In general, good advice is to expand your knowledge and experience different interventions and approaches relevant to your role and make use of any opportunities available to you. There may also be opportunities for secondments, and this is an option for employers wanting to support career development for CAPS within your service. Of course, some trainings are funded, although restrictions in NHS England funded training may apply unless you're able to access this via the upskilling route. Of course, there are options to self-fund. However, I recognise this is a huge limiting factor for most. So on to the next slide, please. So from within the UCL cohort, we're starting to hear about the roles CAPS are going on to post-qualification. Whilst the majority remain in the same roles, a good number of CAPS have gone on to clinical training. Some CAPs have moved into other CAP roles. In terms of the clinical leadership route, the CAP referred to in the slide initially remained in the service they trained as an apprentice. They had previously had experience in other clinical roles outside the NHS, which they were able to lean in on. They also used the experience of CAP and their previous experience in successfully being appointed as a senior mental health practitioner role in a refugee service. One thing that was necessary in order to take up this role was registration on the BPS wider workforce register. However, once in post, supervision with a psychologist was also arranged to maintain their registration. This is, of course, one example, and I'm aware there are other examples out there, some of which you may be aware of. So on to the next slide, please. So in terms of examples of further therapy training, it is a developing field. However, we now have examples of CAPs going into further therapies training in a number of areas. For the UCL course, where specific training is offered in SCM, quite a few CAPs have been able to gain accreditation as SVM practitioners, which opens up opportunities for senior practitioner roles within SCM services or even supervision. Other trainings such as MBT or DBT have depended mostly on CAPs being based in services where this is offered. So there's a strong employer-based justification for upskilling. There's also at least one example I'm aware of a CAP working towards BABCP accreditation, where they've been offering CBT-based interventions and have had further CBT training to offer specific therapy approaches. Finally, I'm aware of one example of a CAP self-funding for psychodynamic training, and there is the potential to see cases within their NHS role for this. However, in most cases, this would need to be negotiated with the employer. So these opportunities are clearly not open to all at this stage, and common to all further training for all psychological professions are very much based on the service setting and the employer's willingness to support these development opportunities. However, there is clearly evidence of CAPs being able to access these trainings, and hopefully this should open up opportunities for others. Okay, so if you can move forward onto the next slide, please. So, in summary, the pathways are still being established, but as Mike will go on to talk about, there is a lot going on behind the scenes. It is hoped that there can be further clarity about career progression opportunities for CAPs and a reduction in some of the unnecessary barriers to progression. Clearly, however, within the CAP role, there is a lot of overlap with the values and needed skills in the NHS, talking therapies and research, as well as clear evidence of career progression with the CAP role as an important enabler. Going forward, I hope to have the opportunity to continue to review this infographic and offer further updates, perhaps from your own experiences. There is also the opportunity for collaborative research with training providers on career progression and destination. Hopefully, over time, we can provide clear advice and resources to support career journeys. Okay, I'll hand over to you now, Mike.
Wonderful. Thank you so much, Angela. My apologies for slightly gate crashing there. The classic Mike error. What I'm aware of, everyone, is that the reason I was making that call is because I had understood that the way that these events worked was that you would be able to see things that I put into the chat, but I've established that that's not the case. So what I'm going to do is, for 1 minute, I'm going to briefly pause presenting here, and I'm going to put up a screen that will have the a QR code and a QR code if you're watching on computer, and you're also able to use mobile whilst I am talking. Please scan that QR code. Alternatively, if you're just watching from computer, don't have access to phone at this point, if you go to vvox.app and type in that code, then what will happen is you will be able to join this session, this VVox session. And what it should look like is in the top right hand corner, you'll see a little kind of like chat bubbles thing. You can click on that and you can enter any questions along the way. I'm aware that this does mean that you haven't at this point had the link to talk that Angela was just discussing. I will make sure that this is emailed out to you along with the slides. I will do that immediately or within the next day. So you'll get initial information, and then we will take a little bit longer to respond to the form, any questions that you're putting into this form. So I'm hoping that has probably given everybody enough time to just log on to that Q&A. If you haven't yet, I'll give you 10 more seconds, and then I will stop sharing again, and I will return to the presentation. And my apologies for the confusion in that case. Okay. So let me return to PowerPoint. And Angela or Layla, because I can see, you can just give me a nod to confirm that my the PowerPoint is back on the screen. Fantastic, thank you. Okay, so back to then. So for this next section, Angela's just given you hopefully some really good ideas for thinking about the ways in which you might progress within the workplace, the kind of pathways that you'll be going to. What we thought would be helpful was to give a bit of an outline of what we see the landscape being for you as CAPS. We also want to acknowledge that the process of being a CAP has not been straightforward for lots of reasons, and this is not meant to be something where we're trying to whitewash some of the challenges. So we do want to talk here about some of the challenges that you have faced as CAPS, but also hopefully give you a little bit more hope than has sometimes been there regarding the work that is happening around the field to address those challenges. I'll be talking a bit about professional registration, because of course that's also an important issue within this that we feel like is helpful to have some clarification over at this point. And then finally, I'll be talking a little bit about how agenda for change is relevant for you thinking in your career development processes. Okay, so why has it been hard for CAPS in terms of thinking about their CPD, thinking about being able to progress along the way that in the ways that Angela has just outlined? So first of all, of course, we've got to acknowledge that this is a new profession. And I will kind of like give a nod to the colleagues who are in Bath or joining from the Southwest, where we know that obviously this was where the English CAP role first developed, and some of you will have been qualified for, I think, coming up 4 or 5 years now. Across the nation more broadly in other regions, really we've had qualified CAPs for 2 to 3 years at the most. And so what that means is that as a CAP yourself, there have been few examples for you to be able to follow. To understand what that career development would look like, but also we're aware that it means that colleagues and your managers will have had a lack of familiarity in understanding how to manage your role. And really, the systems that are around these kind of issues of professional development are still catching up. And I'll talk a bit more about that. We can also acknowledge that there is some confusing messaging. As a new process, there are a number of places where documents exist that might be relevant to the role, thinking about things like the training standards with the apprenticeship, but also the accreditation documents that we work through as trainers that come through the BPS and the portal where we talk about the workforce register. And there are a few issues around the way in which the CAP role is considered, in particular the idea of being whether you're autonomous, whether you're semi-autonomous, and the idea of working under the clinical responsibility of another profession. Now, what I will say is that for more detail, there's a link that I've put on there to a briefing paper that I wrote for colleagues in the Trailblazer, which is led by the employers in CAP. You might find it interesting if you want to know more detail about what's been said there and what's been acknowledged, then that might be useful for you. And I will also send that link when I send you the email with the information about Angela's tool. And then finally, to flag the idea of core profession. And there are 2 places where the term core profession gets used, where I think it kind of like creates some confusion for captains in planning CPD. One of them is in terms of therapeutic training. So for various modalities of psychotherapy, the expectation is that you can only register for that training if you are a core profession. Each of those modalities and the accredited training bodies will have a different terminology around that. But also there is idea of some of the higher level clinical roles. You're expected to have a core profession to apply for a higher level clinical role of the sort that Angela was talking about. And at times it's felt confusing for managers and for captain themselves in terms of their eligibility for that. So what's happening in terms of addressing these challenges? First of all, let's acknowledge that with time passing, those of you who have been the outriders and have kind of like faced this front on your own, I salute you. But of course, we're now seeing that there are over 500 caps in England, including those who are in training at the moment. And what that means is that the familiarity with the role amongst services, amongst colleagues, is growing, and that will be in itself a benefit. The other side is that in terms of two of the processes there, course accreditation is now happening at pace. All of the, I believe that all of the English CAP courses, the apprentices that you will have trained in, have now submitted for accreditation. And something that's really important to be clear about, the accreditation that courses submit for goes back to their first cohort. Okay, so you don't need to worry about the idea that you've done a course and it's not accredited and it's only going to get accredited next year or whatever. All of those processes are about accrediting people who've been through that course already. So if you've qualified from a course that's not yet accredited, we at NTU don't have our accreditation status, for example, you don't need to worry that this will have an impact on your future status. Additionally, there's now, of course, the BPS register being live, which actually, as I'll talk about shortly, brings a certain amount of certainty to elements of the problems that CAPs have faced. What I will say about that second point about the kind of terminology that I was talking about, the Trailblazer, I should explain, the Trailblazer is the group that is employer-led, but includes people like ourselves from the training community and people and CAPs themselves and other interested parties. The Trailblazers is a group who are meeting and they're working with the BPS to think about where those kind of like differences in messaging take place, and to try and make sure that then gives you a better framework for practice and development. So we're acknowledging those differences are there. We have a plan. There's a working group that will be getting together soon to try and kind of like thrash out how we make sure that there's a single message that whichever of these documents you go to, they kind of like are saying the same sort of thing. So that is in place and will help you and also your employees to make sense of what the CAP role is. And then in terms of the core profession status, both in terms of its application to, or particularly in terms of its application to the different psychotherapies, the Trailblazer and Adrian Whittington, the Chief Psychological Officer, have been engaging in work to understand which of the psychotherapy pathways a CAP would be immediately eligible for, which pathways they might need to do further training in one modality before they would then apply for another, and so on. So that work is all happening. Those conversations are happening. It just takes time for them to be finalized. Okay, so this is the bit that I kind of like, you know, you might have noticed we're to be blatant here, we sort of wanted to use to offer you a positive message, recognize some of the things that could be a bit difficult, and then finish with what's going to be another positive message, I hope. But what is professional registration? For anybody who isn't clear yet, all CAPs with an accredited degree can join the BPS register. So the BPS is the only organisation that is registering CAPs. You register as either a child on the child register or the adult register, depending on the population you train with and are currently practicing with. For those of you who have done a degree that is perhaps focused more specifically within a population, such as those of you who might have done the intellectual disabilities pathway at NTU, the way that you would approach this is that you would be registered based on the actual population, the age of the population that you trained with and are currently working with, and that is how that would work. It's important to say this register is approved by the Professional Standards Authority. So it is the Professional Standards Authority are the kind of like highest level of understanding all professional standards across different kind of professional spheres. So that includes, for example, it's the PSA that oversees the registers like the HCPC register, and they are accountable in the government. So what that means is that this CAP registers, the wider psychological workforce registration, does have a kind of a status in the broader system. What do you have to do to be on the register, as well as the accredited degree and maintaining your scope of practice, is that you have to maintain your fitness to practice. And this is the case. So I've listed there some of the elements that are important that a CAP on the register has to maintain that fitness to practice. And what the register does is it has a system then for maintaining for managing any concerns about CAPS practice along the way. So why do we have a register? Why are we thinking about it in the context of you and your development, your CPD? So the purpose of a professional registration is about giving confidence. One of those things is giving confidence to you as CAPS about your own status. It gives confidence to your employers when they are employing you, that you have met certain standards and maintaining certain standards. And also, of course, importantly, it gives confidence to the public, the people that you're working with. Why else might you engage with the professional registration process? It is going to start moving towards mandatory status. So any of you who have been applying for jobs in other employers will know that actually this registration, being on the register, is becoming an essential criteria in some of the job descriptions and adverts that you are seeing. And whilst I've got no doubt that at this point in time there might be some kind of like flexibility around that with some employers, but if you've done a course that isn't yet accredited, it will shortly become the case where actually it will become an essential criteria for most employers, and actually the NHS is developing a document that will make this become a mandatory process. And this is what we see for some of the other psychological professions. So the child wellbeing practitioner, the educational mental health practitioner, have a national mandate to register since April this year, which effectively means that they would not be able to be in employment in those roles without having registered. More importantly for you, it supports the core profession argument, in particular that second element of the core profession argument. So whilst the psychotherapy modalities will be doing their own thing about understanding where a CAP fits within their training pathway, in terms of being seen as a core profession amongst your colleagues, and in terms of applying for high level roles, the registration works in that way. And it's also worth saying that because it's a BPS thing and you have to be a BPS member to be on the register, it means that when we're thinking about CPD, there are a range of CPD opportunities that are provided by BPS Learning. As a BPS member, you have discounts which range from, which obviously depends on the kind of course you're doing. So I was having a quick look and things like there's a 2-hour webinar course where there's a £30 discount, whereas if you are actually doing their supervision training, which is a multi-week, multi-event process, the discount for BPS members is more in the region of about £300. Now, this is the bit where, like, as I say, we're not shying away from some of the problems. There is understandably, CAPS will say, how much? Why do I have to pay this money? And so on. So the application and maintenance carries a cost, and it does include BPS membership, and that is around £200 to £250 per annum. I'm not giving an exact figure because it depends on various things to do with your membership grade, whether you're initially applying, and so on. So we're aware that initial registration and then maintaining registration is going to be in that region. That is frustrating, and especially I think it wasn't because the register is fairly new. Perhaps as CAP starting out, you weren't aware this was going to be a cost that was coming up. I think what we wanted to acknowledge is this is something that is a part of the kind of like professional life and part of working as a professional. Other professions have to do it. So I put up here a few examples. So your colleagues, your nursing colleagues working in your NDT will have to be registered on the Nursing and Midwifery Council, which will cost them £120 per annum. Your colleagues on the HCPC will be paying a similar amount. So of course that includes your clinical psychologist colleagues like myself, but also any kind of like occupational therapists and dietitians, speech and language therapists, etc., who you're working with. So this is something that is part of the process of what has to happen. Clearly, that figure for HCPC and NMC is slightly lower than where it is with BPS membership. I can acknowledge that and acknowledge the frustration that brings. I can say that there are that has been noted, and there are conversations happening around what will happen. I can't tell you anything at this point about where that conversation is going to go. But it's what we're kind of trying to encourage is to recognise it's being part of a professional community, and it's contributing to the way in which you're helping to get the respect that you deserve for the training that you've been through and the work that you're doing. And also, I just wanted to flag for anybody who wasn't aware, professional membership does allow you to claim a tax rebate. So I'm going to move on to relatively briefly giving you an overview of what happens within Agenda for Change, because the majority of CAPs, as we know, are working in NHS systems and are employed on Agenda for Change terms. And so what we also know is that actually, because of the ubiquity of Agenda for Change in the NHS, most private healthcare providers use either the Agenda for Change approach or something similar to it. So this is what it means to be thinking about job profiling and agenda change in a broad way. Every job that has an Agenda for Change pay band is profiled against 16 factors from a National Job Evaluation Handbook. All jobs are profiled against these same 16 factors. So there's a range of things that are more generic, whatever role you might have within the NHS. There are some that might be more clinical, such as responsibility for patient-client care, where you would expect clinicians to, of course, be having a higher responsibility there. And there are some that are more business focused, such as responsibility for finance and physical, where many clinicians wouldn't have a huge factor loading here. And what you find is that this is, so all jobs have a profile of this sort sitting behind them. And adverts, job descriptions, and person specifications build from these factors. They don't necessarily use exactly the same factors in this way, but they are built around these factors so you can understand what's expected of you. For CAPS, as a new profession, we know that there isn't, compared with other professions that have been around when Agenda for Change started and some others since, there isn't a national CAP profile. The question has been asked by the Trailblazers about whether we can create a national CAP profile, and there won't, the understanding is that actually that national group are not setting up new profiles, and so there won't be a national profile, and jobs are profiled locally, although there is opportunity to get example profiles for any, I know there's employers in this call and this event as well, and you're welcome to get in touch with the Trailblazer for examples of how other organisations have profiled their CAPs. So for any of us working in an Agenda for Change job, once recruited to a job, we're expected to work within the profile. So we're applying for a job that we know what it's going to be based on the job description. That job description has been drawn from the profile, and that's what we work within. English CAPs are almost exclusively, and I said almost exclusively just because there's always something that I may not know, but my understanding, I don't know of any newly qualified CAP who isn't on band 6. And that is because the employer will have looked at the expectations that they're placing on that CAP. They'll have looked at what's needed to be a CAP and what you do as a CAP. They'll have looked at those 16 factors, and they'll have done the weighting that works out that actually this is about right. And they'll well, not just this is about right, they'll have followed a calculation. Sorry, I made it sound a little bit more hand wavy than it actually is. And we can see this by looking at the 12 duties and all of those KSBs that the CAPs on the call will know full well, that are outlined in the apprenticeship standards that you've all demonstrated. Again, this is an importance of acknowledging. We know that in Scotland you have clinical associates in applied psychology, and Wales similarly are developing the same kind of role. These roles are actually normally employed at band 7, which has created, understandably, some frustration for our English CAPs because people think it's the same job. What I want to be clear about is that these aren't actually the same jobs, although they sound similar, and they do use the same accreditation standards that we use for training English CAPs, but that doesn't mean it's the same training. So the accreditation standards are saying what the minimum way that you need to approach training, but actually it doesn't define everything about the training. And the thing is that for those Scottish and Welsh roles, what they've developed is a profile of expectation and responsibility, expertise and responsibilities that, if we looked at it in an Agenda for Change way, would have a greater level of responsibility. And that's why those roles are being employed at a different band. So what does this mean for you? The idea is that it's important to be clear, we cannot normally be regraded within a post just because our competence is developed. Employers employ all of us on the basis that they have a budget, they plan their workforce, and they are constrained by that. So there isn't normally the opportunity to be regraded. And this isn't, I'm not just talking about CAPS here, I'm talking about across the healthcare workforce. It does happen, but rarely, very rarely in my experience. However, we can use this way of understanding how our employer has thought about our job to think about our competences and where we develop ourselves. So if we think about a certain agenda for change factor where we know our current role is rated lower, we develop that competence and it makes us eligible to apply for higher graded jobs. And employers should be supporting you with this and thinking about your CPD. So here's an example. Angela gave us an introduction to an idea of a colleague who'd been an advanced practitioner. I just wanted to flag that first bullet point here is about a job advert that I looked at that's for an advanced mental health practitioner. And this is typical where you'll see they have to have a recognised and relevant qualification, and they have to have registration with NMC or HPC or other recognised professional body as an essential criteria. So if you're looking for these kind of advanced practitioner posts, actually being part of the BPS register fits that criteria of another recognised equivalent professional body. So when we look at national profiles, there are national profiles for advanced practitioners, and you see things like on the client care, they provide highly specialised advice in relation to care, and in human resources, they're responsible for teaching or delivery of specialist training. In comparison, when we look at CAPS and their KSBs and the duties that they've been trained in, and therefore the jobs that are likely to be going into, they're more likely to be thought of in client care as providing specialist advice, and in human resources be responsible for providing training in their own discipline or undertaking basic workplace assessments. So you can see that it's a slightly more constrained, less responsible level of expertise. So what do you do as a CAP in considering this? With both factors, you can see that actually the high level job profiles have a more specialist knowledge or are providing a high level of training. So to be eligible, to get yourself eligible to apply for that role and have the chance of success, you might think about doing things like developing your supervision skills through training and experiences, or developing your clinical expertise. And what I'm going to do now is I'm going to hand over to Layla, who's going to talk through a little bit more of some of the ways that you might think about doing that. Layla, you're on.
Hiya, thanks, Mike. So thinking about planning CPD won't be new to CAPS, as it will have been something that you will have been trained in and assessed in as part of your qualifications. But the BPS advises us to follow a cycle of planning our CPD carefully, thinking about different factors, taking the action to actually complete it, thinking about what the outcomes are of the CPD, did it meet what we hoped when we were planning, reflecting on what we need to do next, and starting again. So in terms of thinking about how you might think about planning it, there's 3 aspects we think can be really helpful. So one is obviously thinking about your own interests and passions. Where do you want your career to go? What motivates you? What are your strengths? What do your team notice are real kind of skills in you? Why did you get into the psychological professions in the first place? Alongside thinking about specifically what your development needs are. So are there any areas of your practice that you feel less confident in? Do you really enjoy the client work but feel less confident in service development and evaluation? Where would you like to enhance your practice? Are you co-leading reflective practice but would like to feel more confident to take a lead? And what would help you fulfill your current role better? It's really important, as Mike said, to think about the needs of your team and service as well. So most of you will be developing your CPD skills within your role, perhaps with thinking about future roles in mind. You're much more likely to get your CPD approved through line management and support from your supervisor if it's meeting a team and service need aligned with your own developmental needs as well. So you might be thinking about a specific skill that's model-based, an assessment or intervention-based skill that you want to learn specifically. There might be a specific need for the team relating to current issues that are going on for the team, like burnout, bereavement. It might be a need for reflective practice in the team, and you could train in those areas to kind of support your team. Or there might be a specific need regarding the development of the service from a national or a local level, for example, developing neurodiversity expertise or EDI skills in the service as well. On to the next slide, please, Mike. So in thinking about some of the different aspects that Angela was talking through, how you might apply that in terms of moving towards therapy training. You'll probably notice a theme here that talking about your development needs is something that we want you to be talking about in supervision. Thinking that can be a really helpful place to help you map your skills, your development needs, and get kind of an outside view on that as well. It can be useful when you're thinking about moving towards therapy training to start to build up your existing experience and knowledge of the model that you're interested in training, partly to see if it's a good fit, but to help you establish your core knowledge, as most organisations will want to see some level of introductory training or knowledge of a model. And many NHS trusts will offer introductory level training before expecting you to go on sort of further accreditable training as well. So look out for those opportunities in your organisations. Important to be thinking about establishing a skills gap or need within the organisation. Does this fit with a pathway? Is there a gap? Is there some nice guidance directing you in that way? As well as thinking about, obviously, line management and supervisory support for training. As with most funded CPD, you'll need to be ensuring that you're thinking about being 2 years post-CAP qualification to ensure that you adhere to the HEE rules. And there's a link there to the detail on that to check whether it specifically applies to you. As Mike said, there is work going on to map different therapeutic training processes against the skills that CAPs have, and that's where Angela's tool is particularly helpful. So spend a little bit of time mapping your current skills against the specific training in Angela's tool, but you can also look to the specific organisation that will be offering the training. And that's where some of the different definitions around core profession may impact. Often to complete more therapeutic training, you'll need to have access to appropriate clients to enable you to develop model-specific skills in training for the duration of training. So thinking about whether that's possible within your current workplace. It's also often important if you're doing accredited training to be able to have access to qualified supervision from someone who is model accredited or in some cases accreditable. So thinking about ensuring or networking, I guess, across your organisation to think about how you can access appropriate supervision to support further training is important. Thanks, Mike. And thinking about moving towards declin-sci training, to take another example, a really cool feature of this is developing an understanding of what clinical psychologists do in the NHS. And as an associate role and being trained in the discipline of clinical psychology, you're well placed to do that as a CAP. Perhaps learning more about how that works both in your organisation, but also in different teams for your trust as well. It can be helpful to research training competencies for declin-sci and map your skills against these to consider your readiness for training, because that's what trainers are really looking for in the application stage. Thinking about ensuring that you meet the minimum eligibility criteria for each programme, and there are both kind of national requirements, but also local requirements, which may vary course to course. So some courses will needed a 2-1 from an accredited BPS degree prior to going on to training, whereas others will accept a 2-2. And again, different experience requirements will apply for different courses. So there may be expectation from some courses to have gained experience across multiple clinical and research settings, whereas other providers are very happy to accept people who've got in-depth experience using clinical and research skills in one setting, which often means that CAPs are really well suited to declin-sci training in that regard as well. It's really important that you consider the programme ethos and the training pathway as well. And I've shared a tool here from Heidi Pickett, who's a current trainee clinical psychologist, from her Instagram page with her permission, which talks us through thinking about how well the course aligns with you, your values, the practicalities in your life, and the opportunities that there might be. Often different courses have different pathways or accreditation available, perhaps CBT or neuro or family therapy. as part of it. So thinking about that there's a good match for you there. Again, you'll have to ensure that you meet the HEE rule for 2 years post-qualification from CAP. And often there is really helpful access to mentoring and application support for different marginalised groups, but thinking about connecting with somebody that can help you with the process of applying locally is always useful. And if you get in touch with your local university that you're interested in applying to, they may be able to connect you with those kinds of mentoring schemes as well. Thanks, Mike. In thinking about moving towards leadership as a CAP, again, talk about it in supervision. There's a couple of documents I've shared here which are related to leadership skills within clinical psychology frameworks. So thinking about exploring and mapping your skills and competencies linked with professional body guidance around what leadership looks like in the psychological professions can be really helpful. As always, thinking about establishing the skills gap and needs with your team or service, or more broadly with your employer if you're thinking beyond your service. Those of you that will be attending some of the Southwest talks later on today will have a lovely opportunity to see some fabulous CAPs talking about their experience in leadership roles. And I think networking with other CAPs in leadership roles can be really helpful to help make the kind of transition and understand how you would translate your skills into those positions. Thinking about what kind of training would support both you and your organisation's need for leadership development. So this could be leadership specifically, it could be a management gap, or it might be that supervision skills are where you want to be focusing. So it's worth kind of thinking about breaking down what leadership means to you in this context and what aspect of it you're interested in. It's worth exploring what training you can access locally from your trusts. The NHS offer lots of internal leadership training, both funded courses that you may need to apply for, but also some briefer free training, such as the Edward Jenner programme as well, which are really accessible. It may be that your local CAP training providers offers other opportunities for supervision or leadership development, and as well, the BPS, you'll be able to access discounted rates for different aspects of training. The other advice here would be to think about taking up opportunities when they present themselves at work to stretch and expand your skills and build up that confidence in leadership opportunities. So thinking about taking a lead with service evaluation and audits, join working groups where they're offered to help develop pathways, build experience in chairing meetings where possible, consider taking more of a lead in areas where you've been confidently co-leading for a period, and again, thinking about the service development needs. Thanks, Mike. So an example locally from the Southwest where we've been applying this, we're currently in our second year of piloting, offering further supervision CPD skills for CAPs that have been qualified for over 2 years. So locally, where CAPs are supporting training places for CAPs, you may be involved in kind of mentoring or co-supervising alongside our learners. They're invited to join our supervising learners in practice training along with other DCLIN SCI supervisors who are new to having CAPs DCLIN trainees at Plymouth as well. So we offer a 2-day course split over 4 half days at the moment with training that covers the foundations of supervision, thinking about contracting and how you do that well, cultural identity, competence and humility, allyship and counter spaces within the supervisory relationship and supporting learners in that context, exploring effective supervisory relationships through theories and models and relational dynamics in supervision, thinking about giving feedback and constructive competency development through using effective feedback models, scaffolding, and thinking about the learning need and individual differences that might be present amongst your supervisees, as well as managing challenges and talking about failing trainees specifically. So exploring common challenges, ruptures to therapeutic or supervisory relationships, what your professional responsibilities are as a supervisor, and how to follow the appropriate local policies and procedures when you need to take those into effect. And the final slide, if that's okay, Mike, is just sharing some quotes from CAPs that have been doing the training with us at Plymouth, and we're hoping to do some further evaluation of this in a formal way, to think about how this training has helped people in their clinical roles. But some useful examples here, I hope, which I won't read out, of how the training has helped people feel more confident in the workplace and take up more leadership opportunities as a result. Okay.
Fantastic. Thank you ever so much, Layla. Right, I'm just going to put myself and Angela back on screen, and hopefully people have been able to. So, well, I know people have been able to access the board so far. We've just got 4 minutes before we're going to bring this to a close. So, as anticipated, we won't have a chance to cover all questions that have come in, but I've been reviewing a few of them that have come through. And the first one I wanted to put to was probably Angela, you might think best about this, because people were interested by the example you gave of a colleague working as an advanced practitioner, and they were asking about what band that was. And there was also similarly, there was kind of questions about whether you have to whether a cap is why is a cap, how is a cap able to be eligible for that role. So I don't know if you wanted to just, if you've got anything to say on those elements of that particular kind of role.
Yeah, I mean, I guess I think Mike covered some of these points as well in his presentation, but I guess it's sort of breaking through that idea of what is a core profession. So, I guess with people being on the BPS Wider Workforce Register, they are part of a sort of registered professional body. So I think that it did convey eligibility for applying for that post. I guess that post was in a service which I guess focused on psychological approach. So again, that made it easy to sort of transfer some of those skills that individual had into that role, but also they'd had sort of wider experience as well, which obviously they're able to draw on as well. So I think it is still very specific to the post, which it should be really. It should be about what the post needs, as opposed to I guess the competencies of training, the experiences that you've had, and how you're able to emphasize that and at interview, as opposed to I guess your title, your job title as a cap. I guess that once a person was in the role, obviously that to maintain their registration as a cap, they did require supervision from a clinical psychologist, so that was established for them. In terms of the banding, I'm not 100% sure on the banding for that. I understand it was a 7, but I need to confirm that actually. So I won't definitely say that it was a band 7. It may have been a band 6 role still. But, sorry.
I think if it was a status, if the terminology of the job title was advanced practitioner, it's a high likelihood that it was a band 7, would be my understanding, because advanced practitioner is a term that does have a national job profile within the Agenda for Change terms, and it is matched at band 7. And there are a few people who have asked about why can't we apply for them, and the whole point of what maybe you put that question in before I presented, but just to re-emphasize, this is where the BPS register is coming in. Is it's actually enabling you to give that kind of core profession kind of status. It is a recognised register, it's professional standards authority recognised, and that is one of the reasons that we kind of like saying actually it is an important part of career development. I'm just going to quickly finish. So as that we will get responses out to everyone's questions. There are questions that have come in about specific therapeutic modalities that we will need to kind of make sure we're absolutely clear with you, and about kind of, for example, BABCP and EMDR and so on. I just wanted to, there's a couple of particular clarifications about the register. One of them is that there's a question about why does it cost more than the others. The reason it costs more is because it is a registration and a professional body membership. So, for example, I pay for my HCPC registration, which enables me to practice, but I have to pay extra for my BPS membership if I want to access the benefits that comes with that. Now, what I acknowledge is that you're not being given the choice at this point in time about whether you take up that membership offer, but that explains that difference between them. But the important thing is that there's a few questions that are coming in that are kind of saying, what is there a chance of us becoming HCPC registered, core profession, etc.? The BPS register is the answer to that particular question. And for those of you not yet able to join the BPS register because your course isn't yet got the accreditation, that won't be too far in the distance, and we expect there to be a marrying between when we know all the training is accredited before actually you see complete mandatory status. There was a question about, like, do I apply for something if I'm, if CAPS aren't listed for one of the advanced practitioner roles? I think you could always apply and talk about what the actual context is, because you're able to give that sense. We've got 10:56, so I am going to call this meeting to an end so that everybody has their opportunity for a bit of a break before we kind of go in. And I think Southwest, Lola was saying you've now got a break, I believe. Make sure if you're joining the hybrid event and you're joining online, please do that via the link that you all have been sent by email. For those of you nationally who registered for the national workshop, then please do join the separate link that you will have also been sent. That meeting will be opening shortly, but we will be starting at 11:05 with the actual content, and I look forward to seeing a good number of you there. Thank you, and I hope for those of you who aren't joining the workshops, you still found that useful. I will make sure I'll email out very soon, within the next day or so that you've got a copy of the slides and the links there, so that you've at least got that, and then it will take us, like I said, a little bit longer to get back to you with answers to all the questions and the recording. But I'm going to end it there. Thank you ever so much, everyone, and I hope you have a good day.
Thank you.